Today, you'll have the chance to walk in the shoes of a patient with diabetes. Get ready, it's going to be a busy but productive day. When you first arrive to Chase Brexton, you will check in with our friendly front desk staff. Be sure to bring your photo identification and proof of insurance. If you don't have insurance or don't have enough insurance, you will talk with our social work team for assistance. Don't worry, we are here for you. Your next stop is to meet with a clinical pharmacist. While you venture down the halls, this is your first step to taking charge of your diabetes.
You'll have the opportunity to meet with one of our clinical pharmacists that specializes in diabetes care. Now, as part of a routine visit, the pharmacist may ask you to step on the scale to first check your weight, as well as do some other vitals, such as checking your blood pressure. All this information will be recorded and shared with all the members of your healthcare team. Now, if you have diabetes, you should be checking your blood sugars daily. Here, I'll show you how it's done manually. Having already cleaned the finger with an alcohol swab, I will then put in the test strip, turning on the blood sugar machine. Next, I will use a lancet device to prick the finger and get a small amount of blood. Afterwards, I will gently touch the tip of the test strip to the finger, and the machine will start to process the blood sugar reading. We want to make sure the blood doesn't get everywhere, so we'll put on just a little gauze, and the blood sugar here looks to be 139. A little high, but not too bad. Now, for some people, you may have the opportunity to use something called a continuous glucose monitor, or a CGM for short. Here, we're reviewing one brand of CGM called the Freestyle Libre 2. It comes with a small white sensor applied to the arm and a small blue reader to read the numbers. This can make it a lot more convenient for you to check your sugars all day without having to prick your fingers and get immediate feedback on things like your daily activities, your diet, exercise, and how your medications are working. This machine will also give a lot of extra information to your healthcare provider so that they can customize a diabetes therapy plan to your needs. Additionally, this machine can also sound an alarm when sugars go very low, so a lot of very nice safety features. Once applied to the arm, you can download and review these numbers using a small blue reader device. And to do this, all you need to do is touch the back of the sensor to the reader, and then you'll have the number. After the appointment, the plan that you and your pharmacist have agreed upon will be documented and sent to your medical provider to review.
Next up, meet with your doctor. My name is Dr. Sarah Connor, and I'm a board-certified family medicine physician. I will meet with my patient in the diabetes program on an average of every 3 months. Today, we'll start with a complete foot exam. This is an exam for neuropathy or nerve damage. I will use a monofilament, and although it may look sharp, it's simply like a feather to test for sensation on the feet. I will then check the circulation by feeling the pulses. This can identify feet that are at risk for ulceration and amputation. I will then examine for any redness, swelling, blisters, or other changes to the skin or nails. As I place the tip of the monofilament on the foot, I will ask the patient to say yes when he feels me touching his foot. As you can see, these feet are in excellent condition, and he has likely been following doctor's instructions to examine his feet daily for any cuts or sores. If I had any concerns about his feet, I would then refer him to a podiatrist. We move on to the physical exam, listening to the heart, lungs, and examining the eyes. Patients with diabetes are at a greater risk for developing cardiovascular disease, and we may even recommend additional tests, such as an EKG or stress test, to check your heart health. At the end of the visit, here is your to-do list: a lab order for blood work and urine test, a pharmacy card to pick up medication and glucometer supplies at our conveniently located on-site pharmacy, and a diabetic retinopathy exam card. This you can use to complete an on-site eye exam in less than 10 minutes. Get your vaccines. Each year, thousands of adults in the United States get sick from diseases that could have been prevented by vaccines. Here, my wonderful medical assistant will be administering several vaccines. The vaccines recommended in diabetic patients include flu, tetanus, shingles, pneumonia, hepatitis B, and COVID-19. Diabetes can make it harder for your immune system to fight infections, and can also be harder to control your blood sugar levels when you're ill. This patient handled the shots very well, and no tears were shed. Stop by the lab. We believe it's easier to manage your diabetes when your services are all in one location. Here we offer on-site lab services. Annual diabetes exams include a urine test, kidney blood test, and cholesterol levels. Here again, our brave patient undergoes his last needle of the day. Next up, stop by the pharmacy. If you were prescribed new medications during your visit or simply need refills, no need to travel any farther. Chase Brexton's expert pharmacy team includes pharmacists and technicians who are at the top of their fields to ensure your questions are answered. They make sure your medications are safe and your healthcare needs are being met. If you are prescribed a glucometer, which is the device to check your sugar, you can obtain this here as well. If your medication was not covered by insurance, needs prior authorization, or has a high copay, don't stress. These are all problems that we can address on site. Here at Chase Brexton, we are proud to offer a unique medical device that uses artificial intelligence to detect diabetic retinopathy. This quick test takes 5 minutes to complete and can tell us if high blood sugars have caused damage to the blood vessels of the retina. Just when you think we couldn't offer any more, head on over to our food pantry. Every Meal Matters pantries are available to all Chase Brexton patients. This program helps ensure our patients have access to healthy foods. Every Meal Matters also offers nutritional information, including recipes and handouts, created by our own nutrition staff. Nutrition is a key ingredient to managing your diabetes, so let us give you a boost in the right direction with a visit to our food pantry. With this program, we hope to eliminate some financial stress of obtaining foods that will allow you to follow a healthy diabetic diet. Now that your grocery bag is full, you will meet with a registered dietitian. Your registered dietitian will get to know you, your favorite foods, your least favorite foods, and how much time you actually have for cooking, eating, and exercise. They will work with you to find meal plans and recipes that are both satisfying and delicious. Even if your sweet tooth gets the best of you, they are here to guide you back to a healthier choice. They will help you create eating and exercise habits that fit your life and help control your diabetes. Thanks for spending the day with us and hope to see you soon.